Okay, so let's get started. The topic for this afternoon is the normal and the high-risk newborn. Okay, and we're going to cover the most of the normal newborn issues in nursing care, and then some of the most pertinent high-risk newborn issues. So the first thing that you want to remember, you know, the baby's born, you have a newborn coming out of the vaginal canal, being delivered by C-section. First step is the transition to extrauterine life. So what happens? All the different body systems have to make the transition to extrauterine life. So first, the circulatory system, right? The fetal circulation has to change over to adult circulation, and that means that the fetal circulatory shunts, the ductus venosus, the ductus arteriosus, which is between the pulmonary artery and the aorta, has to spasm and close off. And the third fetal shunt, the foramen ovale, which is between the right atrium and the left atrium, has to close off too. Okay. Typically, a newborn's heart rate is between 120 and 160, and that's pretty variable. Their heart rate is going to go up when they're active and crying. It's going to go down when they're sleeping. Okay. Anything below 100 would be considered to be bradycardia in a newborn, and that's a neonatal emergency. You need to take action, give them some stimulation, give them some oxygen. Okay. Blood pressure on the average is around 78/42, give or take. The blood pressure varies depending on the weight of the baby. Bigger babies will have a little higher blood pressure. Smaller babies may have a little bit lower. And the other thing that you want to remember in terms of the circulatory system is that newborns have a much higher hematocrit and a much higher hemoglobin and a much higher red blood cell count. That's normal for them. And the hematocrit in a newborn ranges around the mid-50s down to about 45. So a newborn who has a hematocrit that's 30 or 35 would be very anemic, and that could indicate blood loss or some other kind of problem. So they're normally polycythemic, and that's something that you expect to see. So how do you facilitate the transition to extrauterine life? The circulatory transition for a newborn, you want to make sure that you monitor their color. Okay. Acrocyanosis, which is the bluish coloration of the extremities, the hands and the feet, is normal in a newborn. That generally persists for up to about a day or so. After that, you have acrocyanosis in a baby who's a week old. That wouldn't be considered normal, but certainly in a fresh newborn it would be considered normal. So you wanted to monitor their pulse, you want to monitor their color, you want to monitor their blood pressure. You want to monitor their overall general activity to make sure that they're active, well flexed, loud and lusty cry, breathing well. The respiratory system, the transition in terms of the respiratory system is basically expanding the alveoli and establishing oxygen and carbon dioxide exchange at the level of the baby's lungs rather than through the maternal placenta. Before birth, all the oxygen, everything's coming from the mother. So in order for the baby to do that, okay, they get a squeeze through the vaginal canal in general. And that helps because it helps to squeeze out extra fluid that may be in the baby's lungs. And when the baby's born, then they have an elastic expansion of the ribs from being squeezed. Out it comes. Right? That causes negative pressure inside the respiratory tract, like a vacuum. The vacuum sucks in air into the baby's respiratory tree. The alveoli expand. Oxygen exchange starts to take place. Okay? For that to happen, for the alveoli to easily expand, you need the presence of surfactant. Remember, surfactant lowers the surface tension, so it makes it easy both for the alveoli to open and also to stay open. Who doesn't have surfactant? Premature babies, right? Preterm babies, generally, they're lacking surfactant. They don't start to make it until much later in the third trimester. Okay, so preterm babies are at risk for respiratory problems. For one reason, they don't have surfactant, and then for some other reasons we'll talk about a little bit later. Okay, normal for a newborn, a respiratory rate around 40 to 60. Above 60 would be considered tachypnea in a newborn. Okay, and again, the respiratory rate varies. It's very variable because newborns are periodic breathers, which means that they do have very short periods where they breathe, and then they slow for a second, then they breathe, then they slow for a second.
How long does that last? Where
What, periodic breathing? Basically, newborns have periodic breathing for a good portion of the first couple of weeks after birth. I mean, you generally see that for quite a long time. So to take a respiratory rate in a newborn, it's essential that you take it for a minute. Because if you take it for less than a minute, you might catch some periods where they're not breathing and some periods where they're breathing faster. So you really have to average it over the whole minute. Okay? They're also obligate nose breathers. In other words, they don't reflexively open their mouths to breathe if their nose is stopped up. So if they have a stuffy nose, if there's mucus in the nose, if there's fluid in the nose, they'll get respiratory distress just from that. So it's really important that you keep their airways clear. That's why we bulb suction their nares. Okay? And we also test newborns. In the newborn nursery, we occlude each nostril, each nare, and make sure that there's no respiratory distress, because they will not just, if you have a stuffy nose, you know, and you're sleeping, you'll open your mouth and snore, right, when you're sleeping, but you'll breathe through your mouth. And children will do that too. But newborns, the first, month or so and beyond of age will not open their mouths. So if their nose is stuffed, you'll see signs of respiratory distress. They'll get cyanotic, they'll have apnea, okay? And then there are also abdominal breathers. They're not thoracic breathers, and kids don't transition to thoracic or chest breathing, okay, using the chest muscles to breathe until they're about 7 years of age. So before about 7 years of age, all kids are abdominal breathers, and they use more of their abdominal muscles to breathe.